Medical services deteriorated in Yemen due to the 9-year conflict. In ties, the war together with the Houthi blockade imposed on the city for 5 years have prevented many families from getting access to medical care. The following report has more on this.
The child Jamal Ahmed Omar, 4 years old, suffers from brain atrophy since birth. The child's condition is difficult and keeps worsening when he does not receive the treatment prescribed for him by the specialist doctor. Jamal's father kept taking him to different hospitals in Saudi Arabia and getting the prescribed medicine at the end of each month. Recently, entry procedures to the kingdom became more complicated and only life-saving cases were allowed, which represented great difficulty for the child's father in obtaining this treatment. The child became in a deplorable condition and his case became complicated day after day.
I am Ahmed Omar, the father of Jamal. Jamal suffers from atrophy since birth. He stayed in the hospital for a whole month and then the doctors prescribed some medicines that he should take. This medicine is only available in Saudi Arabia, but traveling is extremely difficult and expensive, and the journey is really dangerous.
The father of Jamal could not watch his child suffering, so the paternal affection called him to obtain a marine permit from the region to cross from the port of Midi to the city of Al-Houthi in a dangerous sea trip that may sometimes lead to death. They take a primitive boat that lacks the most basic elements of security and safety. This journey takes approximately 30 minutes and it costs a lot in the Saudi currency.
This medicine is not available here in our area and we are trapped here as the Houthi militia is imposing a blockade on Hayran district. I call on the Minister of Health and the Director of the Health Office to provide us with this medicine, as my child really needs it. He could die if he didn't take it.
The father got the treatment, but the tragedy begins when this treatment ends and the suffering returns again. The father appeals to the Ministry of Health and the Director of Health and the Governorate to take this matter into account and work to solve this problem that affects Jamal and other children, as their suffering has increased and they have become in a difficult condition, and their parents are unable to provide most of the necessities of medical drugs that may work to improve their condition.